Yeah, girl, we got this test to study for, and I'm just like stressing out about it.
So nervous.
I don't know.
Are you okay?
Are you having chest pain?
How long has this been going on?
It started earlier today, but it's getting worse.
Really? You should really go to the doctor and get it checked out.
I'm gonna go. Come in.
Good evening, Mrs. Morton. My name is Radija Smallwood. I'm going to be your nurse practitioner today. Can I check your bracelet?
Yep.
And when is your date of birth?
It is September 21st, 1995.
Awesome. That checks out. What brings you in today?
I was just having really bad chest pains. It started from early this morning, and it just started getting worse throughout the day.
Okay, that sounds awful. I'm sorry that you're experiencing that. I'm going to go ahead and grab your vital signs so that we can know what's going on. All right. Can I ask that you sit up in the bed, please?
Yep.
And go ahead and take your time. Does the pain get worse with exertion?
Yes.
I'm so sorry to hear that. And do you have a lot of stressors going on right now?
Yeah, I mean, I'm in school and I work, so...
What are you studying?
I'm actually going to school for nursing.
That can be extremely stressful. Interesting. Your blood pressure is extremely high.
What is it?
It's 160 over 100.
Oh my gosh.
Yes, this is a medical emergency, so I'm very happy you brought yourself in today. I'm going to go ahead and listen to your heart.
Okay.
It seems to me like you have unstable angina.
What is unstable angina?
Unstable angina is chest pain that we can't really keep track of. It progressively gets worse throughout your day. And like I said, this is a medical emergency, so it's important that you brought yourself in today. In my opinion, I would recommend that you take NitroSTAT. It's a form of nitroglycerin tablet. I'm going to give you the 0.4 milligram dosage. I'll be right back with that.
Thank you.
You're welcome.
NitroSTAT acts directly on the smooth muscle blood vessels, causing relaxation and dilation. It decreases cardiac preload and afterload.
Come in.
Hello again, Mrs. Morton. I'm back with your medications as promised. Can you confirm with me your date of birth?
My birthday is September 21st, 1995.
Awesome. That's what I've got on my sheets, as well as my medication labels. Let me double check your bracelet. Perfect. Everything checks out. Before we get started, I'm going to ask that you take a couple sips of this water. The reason being is that dry mouth inhibits the absorption of NitroSTAT. So it's important that you have fluids.
Okay.
Okay. Perfect. Now I'm going to head over to my medicine cabinet and grab your medication.
Okay.
Ding! Boop, 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 ding! Check this label. NitroSTAT 0.4 milligrams. Awesome. Drug. You need to stick it underneath your tongue and allow it to dissolve. Do not crush, chew, or swallow this medication.
Right under the tongue.
Right under. So when you take this drug, you may notice a stinging or biting sensation. That just means that the tablet is fresh. Also, always remember to take this medication when sitting down, and take caution when standing up. It can cause hypotension, and you may notice orthostatic hypotension when standing. I also want to make sure that you know, do not drink alcohol with this drug. Drinking alcohol can cause hypotension, faintness, and weakness. So it's not safe, and you just want to take caution. In a few moments, I'll be back to check on you and make sure everything's going all right. Okay, Mrs. Morton?
Yes.
Awesome. See you soon. I believe it's been 5 minutes. I should go check on my patient since this is the peak of the medication.
Come in.
Hello again, Mrs. Morton. I'm back to check on you. How is everything?
I am noticing my mouth is a little dry.
Well, I wanted to remind you, you can now take sips of this water again. Now that the medication is dissolved, it's important that you stay hydrated, as I said.
Okay.
Has your pain subsided?
Yeah, I feel a lot better.
That's awesome. What I have to do now, I'm going to take your vitals while you're laying down and sitting up, just to make sure everything's going all right.
No problem.
Go ahead and lay down for me.
Here, can you take this cup for me?
Of course.
Thank you.
That looks great. 120/80.
Perfect.
All right, will you sit up for me, please?
Mm-hmm.
Nice and slow. Take your time. Perfect. Everything looks good, Mrs. Morton. 120/80.
Good.
I just want to remind you, when you are getting up to leave, make sure you take your time in standing up.
Okay.
As I said, orthostatic hypotension is one of my concerns.
Yeah, I have to remember that.
All right, no problem. I hope that after taking this medication, we can get you back on your way. All right? I'll get you set up with some of these tablets to take home.
Thank you, doctor.
No problem.
Seek medical attention immediately if pain is not relieved. The side effects of NitroSTAT are headaches, dizziness, syncope, nausea, vomiting, blurred vision, diaphoresis, flushing, pallor, rash, dry mouth, palpitations, paresthesia, peripheral edema, intolerance. The adverse effects are orthostatic hypertension, tachycardia, cardiac bradycardia, and most likely are in circulatory collapse. Please do not take this medication through taking Viagra, Cialis, or the future, as it may increase the blood pressure and lower the effects of nitrates. This medication can also decompose when exposed to heat and light, so store it away in a dry place.
Life is great after NitroSTAT.
Yeah.